and I'll give you a small reminder that this session that you have found yourself is the Family Resource Centers Network of California. That's the FRCNCA, support for families of children with disabilities. And this is really about what it looks like from the perspective of professionals that do this every day. What does it look like to support families, and what are some strategies that you can implement right away? To do that, we have three presenters with us that I'd love to introduce on the next screen. We have Dr. Yvette Baptiste, who's Interim Executive Director of Family Resource Centers Network of California and Executive Director of the Eastern Los Angeles Family Resource Center. Yvette, Dr. Baptiste, she's allowed me to call her Yvette, I'm so grateful, has 39 years of experience in the California Developmental Disability Service System in almost every role. She's a clinical psychologist with a specialization in disability, community, and cultural psychology. She's a mother of three children who have special healthcare, behavioral, and developmental needs. We also have Robert. Robert Rochin is the Education and Training Division Manager at the Family Resource Centers Network of California. He brings over 20 years of experience supporting children, adults, and families across the disability and special education systems from early start through adult transition. And we also have Dulce. Dulce Flores is an early childhood and family support professional with extensive experience in early intervention, parent coaching, and community program coordination, recognized for building strong relationships with families and leading training and supporting child development and family empowerment, a passionate advocate who brings both professional experience and lived experience as a parent of an 18-year-old daughter with autism. So what we'd like to do around here at CalTrin is we give our friends emojis to clap them up when they enter the room. We do that through your little reactions at the bottom of your screens. We love that to show, thank you. This shows our virtual support. And with that, I will kick it over to you, Robert. Thank you so much for today's session.
Well, thank you, Jessica. I gotta say, my mentor, my leadership icon, I was a graduate of the Emerging Leaders Development Program, and Jessica was my mentor. A fabulous program I highly recommend. So just a plug for Caltrin, because it was great. All right. So you already know who we are, but everyone who is a presenter with me, Yvette and Dulce, can give a quick wave and I'll get us started. Welcome to the webinar. All right, so before we get going, I'm going to read the objectives here. And as the title of today's session does suggest, we're really focusing on supporting families of children with disabilities and the role that FRCs play in that process. So to guide our time together, we have these little objectives. First, we'll spend some time describing the role of FRCs in supporting families and why lived experience is such an important part of that support. Second, we'll recognize some of the stress and challenges families may face when navigating services and systems. And third, we'll talk about the pathways of support across the systems and how FRCs can help bridge those gaps. And finally, we'll make sure that everyone knows how to locate their local FRC and how to make a referral. So by the end of the session, you should have a clearer picture of how FRCs support families and how you can connect families to those resources. And to start, it helps to understand where the idea of family support really began. So let's take a quick look at the history behind it. All right, so as you can see from the slide, the concept of family support actually goes back much further than most people realize. In the late 1800s, settlement houses were created in major metropolitan areas like New York, Boston, Chicago, and San Francisco. And these centers were designed to support large numbers of immigrants entering the country at that time. Settlement houses provided services such as job training, English classes, and social support to help families understand, adapt to, and succeed within their new communities. The photo you see here is actually Hull House in Chicago, which was established in 1889 and is often considered one of the first settlement houses in the United States. Now let's fast forward all the way to the 1970s when the term family support began to emerge more formally. Programs started developing to support parents with young children through information, resources, and community connections. Many of the ideas that shaped those early programs are still reflected in the FRCs today. Like those early efforts, FRCs are community-based programs that support services and activities that are free or very, very low cost and designed to strengthen families. But over time, California took this concept even further, especially when early intervention services began expanding in the 1990s. Gosh, it's so interesting to say that in the 1900s. So, as family support programs continue to grow, an important milestone happened in the early 1990s with the implementation of Part H of the Disabilities Education Act. There we go, which is now known as Part C, the Early Intervention Program. In California, something unique happened during that process. The state intentionally included family resource centers as part of the early intervention system. The inclusion of FRCs and the implementation of Part H, which is now Part C, was innovative and, as far as we know, something that was pretty unique to California. Then in 1993, the California Early Start Intervention Services Act, also known as SB 1085, formally recognized family support as a core component of Early Start. This made Early Start Family Resource Centers a non-discretionary part of the system, meaning family support was not optional. It was built into how services were delivered. This decision here really, helped establish the strong network of family resource centers that we see across California today, which there are 47. And to help us understand how this system operates, I'm going to hand it over to Yvette, who will walk us through a bird's eye view of the developmental services system in California.
Thank you, Robert. You're a hard act to follow, but I'm going to try. Um, so, as Robert said, the Individual with Disabilities Education Act has has several parts, but the two parts that concern us are the Part C, which is the early intervention program. That's a national effort, and in California, we always do things special in California, and the Part C program is is I guess managed by the Department of Developmental Services, and they contract with regional centers, 21 statewide, that implement that program. Um, there is Part B, which is also comes in and is managed by the California Department of Education. But for early intervention, some of those same children are served by their local education agency. Those kids are called children who are solely low incidence, which means that they are deaf or hard of hearing or blind, visual impaired in some way, or the third group has kind of an orthopedic um, disability that requires specialized services. Those children are also early start children. So if you come into contact with those families, they are also referred for family support through the Family Resource Center system. The FRCNCA, the Family Resource Center Network of California, subcontracts with the Department of Developmental Services for in two programs. We provide um, services through a community navigator program, and we also provide professional development training to the 47 FRCs that do the early start family support. So as a organization, FRCNCA is involved with both Department of Developmental Services and the regional centers to provide navigation services to families from birth to old age, the whole lifespan, and to support families whose children have are are birth to three and have a developmental disability or are at risk. And so this chart shows you that relationship. Next slide, please. Now, the Family Resource Centers Network of California is, as I said, and Robert said, comprised of 47, although that number changes sometimes, depending on contracting. And we're funded by DDS to provide that family support and navigation. Um, However, these are families primarily who are served through their local regional center. We do help families that are not currently connected to regional centers do that, but by and large, our services and supports are for folks in the developmental disability system or who are wanting to access. We are in all 58 counties. There are there are 10, for example, family resource centers in Los Angeles County. And in San Diego, there's one that does several counties. So um, we have a way for you to connect that we'll tell you about later on. But as Robert indicated, a lot of these centers were built on the fact that we were formed during the implementation of Part C 40 years ago. Many of the directors and parent leaders come from the folks that were going up to San Diego, meeting in their local areas, trying to figure out how to build um, family support into the early intervention system in California. And they are really the foundation for a lot of the family-centered practice and parent-centered work that's done for families with children with disabilities. Next slide, please. Oh, I just wanted to share the Family Resource Center Network is a network. We are not a 501c3. We have a fiscal agent. We are partnered with Haluna Health. And but we do have a network of officers and a steering committee. And our vision is for California where all individuals with or at risk for disabilities and their families have access to inclusive, high quality services and supports that they need. And so our mission is to kind of support our own sustainability, our expansion, and to promote amongst all agencies, all areas of the state, a family-centered, parent-directed, and community-focused practice among family resource centers. And in that way, we partner with other family resource centers, and Robert will tell you about that right now.
Great. Thanks, Yvette. Yeah, so we're going to talk about other FRCs. So when we talk about family resource centers, it's important to remember that that term, family resource centers, is used by many different organizations. And so depending on the organization, their focus, the populations they serve, and the scope of their services they offer can look quite different. That's why it's really helpful to be familiar with the different family centers in your community. Knowing what each one specializes helps to ensure that families are connected to the place that best fits their needs. But at the same time, because it is a lot to remember, our FRCs operate with a no wrong door policy, which really means that if someone reaches out and it turns out another organization may be a better fit, the FRC staff will help guide that family to the right place. So the goal is always the same, making sure that families get connected to the support that they need. Now that we've talked about what FRCs are and how they fit into this larger landscape, let's take a closer look at services that a family resource center provides.
And Robert, I would just add here, I know there may be members here or FRCs that are part of the California Family Resource Association, CFRA. And we are also, as an organization, a member of CFRA. So just wanted to point that out.
Absolutely right. All right, so at this point, you're probably wondering, well, what exactly is an FRC within our network, right? So at the core, FRCs are really community-based organizations that support families of children with or at risk for developmental disabilities. And one thing that makes them unique is that many of our staff are family members themselves. They may be parents or caregivers who have navigated these systems personally. So the support they provide often comes from that lived experience as well as some professional training. Across the state, all family resource centers from our 47 within the network provide the 5 core services under their contract, which we'll talk about a little bit later. Um, and they also just want to point out that they serve families and professionals alike. So families may come in for peer support, information, and help navigating services, while professionals can also get information and education and often partner with FRCs to connect families with resources in their community. So, as I mentioned before, FRCs operate with that no wrong door policy, keeping that focus on getting the families connected to the right place. And while every FRC shares these core principles, they are very flexible and reflective of the communities that they serve, which means services may look different depending on the local need. And here is a perfect example on this slide. In this photo, we have the Family Resource Center in Eastern Los Angeles, this is an office space, but families can come here to receive services, but it's intentionally not designed to look like that, right? It's more warm, it's welcoming. Families can walk in. It doesn't feel like a formal agency office, and it feels more like a place of support where families can connect with folks who understand what they're going through.
Even though we do need a paint job.
Who doesn't, right? All right. So one thing I do want to make a point of is to know that the family resource centers can look different, right? Depending on where they're located. You saw Eastern Los Angeles, but even the smallest FRC is part of this larger network of the 47. And each one reflects the needs, the culture, and the priorities of the community that it serves. And because of that, services may look a little different. Some FRCs are located in urban areas, like in Los Angeles, where we have 10. Others serve very rural communities all the way to the very top of California. Um, and, some centers might have different staffing, right? So some centers have 1 or 2 staff members, while others have larger teams that really include program staff and navigators and administrative support, which is really wonderful to see. The way services are delivered are also expanded over time. Families may connect with an FRC in person, by phone, and as we all learned through COVID, virtually through any of those platforms like Zoom, to get connected. All 47 of our FRCs do have early start funding, but many also bring in additional funding through their local, state, or private sources to expand the services they provide to families. All right, so now I'm going to talk a little bit about the different California Family Centers. So as I mentioned, all 47 are part of the early start, but there's these other areas here that I'll go over. And this slide really highlights that there are different programs across California that focus on that family support. And so for example, we have Early Start, which focuses on families of infants and toddlers from birth to age 3. These programs are funded by DDS and support families who have children with developmental delay or disability or at risk of. And then beyond Early Start, we can go into the Family Empowerment Centers, or FECs. See, this like word salad even confuses me sometimes, which support families of children and youth with disabilities from ages 3 all the way to 22. And these centers really help families better understand their child's educational and developmental needs, strengthen the communication between schools and providers, and support families as they navigate that IEP, which is the Individualized Education Plan process. And then California has parent training and information centers. These are called PTIs. Don't worry, there won't be a test on these acronyms here, but these are federally funded programs that serve families from birth all the way to age 26. But PTIs really focus on helping families actively participate in their child's education and development, while also partnering with professionals and policymakers to improve outcomes for children and youth with disabilities. And finally, our newest program, we have the not California, Community Navigator Program, or CNP. It's in California, though. This supports families across the lifespan, and individuals who are connected through the regional center system. Community navigators provide individualized guidance to help families and individuals understand services, navigate systems, and connect with the community resources. So while these programs may have different funding sources and serve families at different stages of life, they still share that common goal of helping families access that information, support, and services, and understanding how these programs fit together better will help you recognize the different pathways of support available and identify where FRCs can help bridge those gaps for families. Okay, so we covered a lot of information already over the last few slides. So I really wanted there to be one thing that you remember is that an FRC is a place where individuals, families, and professionals who serve them can receive services and supports. And for many families, an FRC becomes a place where they can ask questions, connect with other parents, get guidance from people who understand the journey that they're on, right? So at the end of the day, FRCs are really about connection, support, and helping families do that, and individuals as well. The big part of that is understanding the meaningful role of lived experience, which Eva is going to talk a bit more about.
Thank you, Robert. If I can stay out the chat. Well, yeah, I wanted to talk to you a little bit about the importance of lived experience and connecting families to people with lived expertise. Um, um, Actually, Robert, this is where I wanted to bring up, and maybe CalTrins can also, if because I think they provide this training, is the standards training on family support. So, um, some of what I'm going to be talking about, particularly around family support, you can get more training around uh, by being certified through that standards training. But one of the uh, things that's shared in that training is that family support is a type of grassroots community-based program that prevents, that is a prevention program, and it's designed to prevent family challenges by strengthening the family themselves and therefore strengthening that parent-child relationship and helping parents to have what they need in order to be good nurturers and providers to the family. This has really been a shift in human services delivery in that families are not pathologized, and it encourages agencies to work together to be more preventive focused and more strength-based focused. And we have found, research has found this to be most effective for making change in families. But we also know that through research that it is important that families are resources to their own members, that family to family, peer to peer, like in Alcoholics Anonymous, peer to peer, these programs are exceptionally effective for making change in someone's individual life and therefore in the life of the community and their lived experience. So having uh, someone that you can connect to that have had similar experiences to you and can have a level of empathy with you is extremely important because, and the next slide will show you that uh, can we get, yep, that family, that one of the things that impacts families who have children with or at risk of a disability is the level of stress that's related. Has anyone ever heard the analogy of around the trip to Holland for families with disabilities. There's um, a woman that actually was one of the first to tell this story. I believe she had a daughter with Down syndrome. And she said that throughout her pregnancy, she felt like she was going to Italy, right? And she was planning for that trip to Italy. And she was packing for a trip to Italy. She was looking up all of the things that she would do when she would get to Italy. But when she got on the plane and the plane landed, she was in Holland. She was in a totally different place than she had prepared for in her clothing, prepared for in what she was going to do that day, maybe even the money that she was going to have. Um, it was a totally different reality for her. And as I think about it, as I was thinking about how I would, explain this to you, I I looked up. It takes 16. I think it takes 16 hours to get to Italy on a plane. And arriving in Italy, even if someone tells you, okay, now you have to go to Holland and you have to walk. You know how long that's going to take you? It's going to take you 3 to 4 months, right? So when you're thinking about, here's this person that's come to you for help, and they're just finding out that they have a child who either has a disability, born with a disability, or is at risk, that adjustment takes time. And it's the stress of that, in addition to the system barriers that this family is dealing with at the time. And one of the solutions that research has shown is having someone who can help them to navigate, who can provide that emotional support, that can give them resources that they can call or email or text on the weekends. That helps to this little circles of stress, this circle of stress and fear and distress that families experience. I just want to talk a little bit about um, this figure here, this diagram, and I'm going to start at quality of life because I want to give you a sense of the reality, kind of in a generic sense, right? Because, you know, y- not all families experience um, the stress related to becoming a parent of a child with disability in the same way. But these are all potential stressors. For one, around quality of life. Okay, so quality of life is how much a person feels comfortable, healthy, capable of enjoying life in the way that they are wanting. And frequently, things that are affected for parents with disability is that maybe it was a two-parent family and both parents were working. Um, Sometimes and frequently, one parent has to stop working. So the family income, one half of the family income might go away. The pleasure of going to work and having a career might go away. Um, in Los Angeles County, for example, it takes 2.5 full-time jobs to afford housing. And so people may be forced to, give up some of the standards of life that they're used to. Well, a lot of people have to deal with biases in different ways. But a family with a child with a disability or an individual with a disability, there's some institutional, um, disability related, economic, cultural, sometimes linguistic. And if we think about those folks, you know, in what they would call the true Northern California areas of the state, those geographic stressors and bias that they deal with. So I really encourage you to, I think Jessica said it's on March 12th, revisit and come to that implicit bias training that they're having. In addition, the response that the person could have, the emotional response, sometimes those adjustments are um, indicative, the need for support around anxiety and depression and other kind of psychological depression, distress is evident. And that's not necessarily something that a peer-to-peer model helps with, but there are ways that that I'll talk about shortly that family to family or peer-to-peer support helps with, such as support groups. And then lastly, well-being is really about how much you're able to feel gratitude and hope and resilience. One of the studies that I used at really as a linchpin in my dissertation was related to resilience in young children as they become adults who have disabilities. And there's a direct relationship between the attitude of resilience and well-being in the family and the parent related to that resiliency that uh, adolescent or young adult showed in relationship to their ongoing disability. And so we really do pass on some of these things to our children. And so the more resilient we can make families, parents, the better. So this is how we do it. In the next slide, you'll see some of the things that family resource centers do specifically. So there, as Robert mentioned, there are 5 essential services. Parent-to-parent or peer support is where that member, that family member, that caregiver, foster family, someone is connecting with a staff member who understands their culture, their language, and their lived experience. There's a typically, Dulce will talk about how we develop that trust relationship and how we offer kind of ongoing support. Families also need information and referral to other kinds of services, and many of you all know that. However, the developmental disability system is highly complex, and so it's really not something that's clearly known about. And so that specialization really sits within our family resource centers, and we really encourage you to be that partner for referral. Public awareness and outreach. So we are always building that visibility about the program. We do that through partnership. We'll talk about that a little later on. So some of you may want to, once you find out where your local FRC is, you might reach out and see if there's ways for you and that FRC to build public awareness and do outreach events together for families. Parent professional collaboration. So this is the interesting thing about the disability service system is that there is this emphasis on uh, having trusting partnerships with the professionals that are supporting the child or adult with a disability. And families and professionals work together, as equal partners. This is particularly true whether it's the families looking at, oh, what are the services and supports we need from the regional center, or what are the services and supports we need from the local school district, or even what are the services and supports available at the local Y. So it's really about helping families to understand how to ask questions and collaborate with those providers out there that are supporting their child or supporting them. And then lastly, we know that people with disabilities will continue to grow and thrive and have lots of different transitions in their life, just like any other person. And so they will go to middle school, they will graduate from high school, maybe go to college, right, Dulce? They will, uh, get a job and then maybe have to retire, just like anyone else. So we help folks with these transitions as they move to different activities and challenges in their life. Next slide. So we have an example here, right, Robert?
Yeah.
I'll throw it back to you.
Thank you. Yeah, so we wanted to share a short video that highlights what family support can look like from the parent's perspective, because you've heard enough from us. Let's hear it from a parent, right? In this video, you'll hear from a parent named Paloma, who shares her experience connecting with the local FRC and working with the family support specialist named Maria. And she'll talk a little about how she got first connected and the kind of support her family received through the FRC. I will point out as you listen, you can find the ways that connection and lived experience made a difference for her and her daughter. So I'll go ahead and press play and let me know if I didn't share the sound, because Jessica, I can't remember if I did it after the third attempt or not. So
Okay. Sounds great.
My name is Maria Chavarria. I'm a family support specialist for Special Kids Connect Family Resource Center. Today we have our beautiful family here, Paloma Barraza and her daughter, Quetzali.
We first heard about early start when my daughter was diagnosed at 3 months. She was diagnosed with cerebral palsy, right hemiplegia at 3 months, and our pediatric clinic gave me a whole bunch of papers, and the one right on top said Special Kids Connect, and that was the first number that I called. It was an amazing experience. Quetzali was born during COVID. She was diagnosed during COVID. I was a first-time mom, and I had no clue what to do. So when I picked up the phone and I called Special Kids Connect, I just had a gajillion questions. I stayed on the line for about maybe 2 hours. It was with you, asking a whole bunch of questions, and every single question and concern that I had was answered. It's support directly for the families, and they support you in whatever help or resources that you might need or want or are curious about. And it tailors to your child as well. With my daughter Quetzali, I noticed at a young age that she loved water. Special Kids Connect was able to help me and guide me and say, well, you call this, call this gym, call this place. They focus with water activities. So it's like there is so much help that you can gain the help and the knowledge through the comfort of your home. So even people that might have the barrier of transportation or even the language barrier, there's workshops that are virtual, there's workshops that are in person, there's staff that are bilingual. So I would say there's a whole bunch, but our favorite one is the Play and Learn. Quetzali also has made friends in those Play and Learn groups. And also in times, like I said, during COVID when money was tight, like even the diaper drives helped us a lot. So thank you. Well, you guys are pretty easy to find. You guys are everywhere. You guys are on social media, online. It's every time that I've called, there's always someone there to pick up the phone. I come with a background in special ed education. I have 3 credentials, my master's. But still, when it was my turn now I'm the parent. you feel that you're incompetent sometimes and that you don't know. And you want the best for your child. Gracias, Quetzali. And Special Kids Connect makes sure. ¿Estás feliz? Estoy muy feliz. Makes sure that you get and that you have everything that you need to make sure that your child has a successful. No, estoy feliz. Has a successful life, you know. And yeah, just don't be afraid to ask for help. And like I said, you tailor it to the family and to the child's needs. The biggest thing that I would tell the community is you have a voice and use it. And if you don't use it the first time, it's okay. You'll have a second chance, you'll have a third chance, and you'll get better at being an advocate for your child. So just have hope, don't give up, and there will always be someone there.
So, as you just saw, that was a real example of what family support can look like in practice. And I love that video because that moment that stands out to me is when her daughter checks in on mommy and asks if she's okay, and making sure she's not feeling sad. And it's such a sweet moment, but it reminds you of how aware children can be of what their parents might be going through. So, yeah, that was a perfect example of family support in practice, which then leads us to our next activity. Yvette?
Well, Robert, I'm just trying to catch my breath here. That was so sweet. So this is what we want you to do right now. We want to send you out into groups for you to think about and maybe talk about from our conversation so far about family resource centers, family stress, the importance of lived experience, and this video that you saw. What is important for you to remember to do when you encounter a parent or a person with a disability who's seeking support from you and your agency? What are a few things that you need to be thinking about doing to help them based on what you've heard so far? So I will throw it back to whoever's gonna throw you into groups.
Yeah, I think Jessica's going to help us out with that. You'll be in these groups for 10 minutes. So go ahead, don't be shy. We're all family here. And you can have your discussion. And when we come back, remember some of the things you talk about because we'll would love to hear them. And time permitting, I don't know if we're going to take you off on mute or in the chat, but just be mindful of what you're capturing in these breakouts.
Great. We're going to get this breakout started. Just so you know, participants, it'll be small. There'll be 3 to 4 other professionals with you on that call. And here at CalTrin, we like to just remind you, and I will demonstrate this myself. Let me spotlight myself here, that when we are in a breakout room, especially with one like this, where we're learning information and talking about how to apply it, you and I both know what it feels like to get into a breakout room and your partner does this. Ghosted? We don't want that. We're real humans on this call today. And let me tell you right now, nobody understands the nature of your job like the people that are going to be in that room with you. So if you are willing and able to be in this discussion with other professionals, I'm going to ask you to say yes in the chat. This is your commitment to be here with each other and really talk through, as Yvette has said, your goal in this activity is to say, with the information that I've learned, with maybe even that testimonial that I heard, what does it look like to support families with disabilities? We're going to do that for 10 minutes. Thank y'all. We appreciate you. All right. So I'm going to start this and we will see you in 10 minutes.
Welcome back. Welcome back. Everyone's coming in. I see your cameras. There we go. Well, how was that for everybody?
It was good. It was good to share what agencies we work for and what our programs do.
Yeah.
So it's always
Anita,
a good thing. Mhm.
Anita, since you unmuted, why don't you share something that was shared in the group in terms of how you're going to remember or change your practice when you encounter a person with a disability or a family member?
Uh, I think it's for me, I currently work in helping families that have children with special needs, and we do refer out to the Family Resource Center a lot. So,
Which one?
I'm in San Diego.
Okay.
So,
Exceptional Family Resource Center.
yeah, so we do refer out a lot, but I think it's always good to hear all the other things that you guys do provide that
Yeah.
can benefit families. So to me, it's always good finding out about the different things that the programs do offer and whatnot. So it
Yeah.
was good.
Thank you, Anita.
Hmm.
What program are you with? What agency?
I'm with the YMCA,
Oh,
Resource
great.
and Referral. Hmm.
Thank you.
You're very welcome.
Thanks for your work. How about one other person want to share from their group?
Hi,
Okay,
my
Jose.
name is. I sorry.
Yeah, Jose, go ahead.
Okay, sorry. Hi. My name is Jose Teran. I live here in Victorville, California, and I'm very empathetic with this topic because I have an angel with feet here in my house. My daughter Marja, so she has a tracheostomy, and she takes also the feeding with YouTube.
Uh-huh.
So, for example, for me and my family, it's helped a lot that I. Island Regional Center because they she received that physical therapy, you know.
Uh-huh.
So it's helped a lot. Sometimes Marja needs to go to San Bernardino, and
Uh-huh.
then another weeks they receive the therapy about by Zoom. But it's very important that helps. So also I share also with another parents knock this agency this resource because it's very important now for other families and it's helped a lot no so she's my
Yeah.
baby it's here so it's very I'm very thankful and also it's very important the educational because the kids
Oh.
has a different normality you know but she needs to always I said Marja needs to enjoy the life
Yeah.
we sometimes we go to Disney sometimes go to Dodger Stadium because I love the baseball but always I said obviously if it's extremely cold okay she didn't go outside but when she can go outside go to the park because sometimes all the parents has a little feel sad because oh my kid has this situation no they are angels they are humans they need to enjoy the life that is the best important thing and obviously the faith that is the best important so faith plus resources it's the best formula.
Well, thank you, Jose. And you bring actually up a very important point to always remember. For example, um, we connect with lots of different families who have lots of um, different viewpoints about things like um, how they refer to their children. Some parents, for example, um, would say, "I have a child with who is autistic," where professionally, for a very long time, we didn't say that about children because the people with autism had said, hey, we are people first, right? Disability after. But the times change and families and individuals talk about themselves and their children in the way that's most comfortable for them. And so you referred to your daughter as an angel with feet. There are families that would say they don't want to refer to their child that way, or with special needs, or some people prefer disabilities. So we are always turning and facing the family or the individual and having them take the lead around that. And I really love that you shared your beautiful daughter with us and you shared your experience. We didn't know we would have this today, that we would have someone sharing their own experience and their own reality. So thank you for that, and I really appreciate it. So we're gonna move on and talk about uh, just a little bit about how the developmental disabilities system is changing in another way. There was an LA Times expose in 2011 that said that uh, in the regional center system, folks who are white, whose children were white, or as an adult that they were white, they were receiving more funded services than others, either because of their language. Those others really had language differences and or racial differences. So when these disparities were exposed, the legislature here in California said we need to have a response. And they funded the Department of Developmental Services with about $11 million to address these differences so that there was equal access to services and supports to every California, regardless of race, ethnicity, language. And since 2016, there have been a lot of funding out there to really help families to understand that these services also exist for them. And just to let you all know, this equity funding is available to all agencies, not just agencies currently serving uh, individuals with disabilities, but who want to be able to reach out, generic agencies or generic community-based organizations that want to gain expertise in this system. So you can always go to dds.ca.gov to get connected to those funding opportunities. Next slide, please. So one of the areas that the Department of Developmental Services said, hey, let's do something very specific, is that they funded the family resource centers, at least 21 of them that you see here. I know you might not be able to see the logo, but when you get the slides, you might recognize some of the logos. These family resource centers to help families to get connected to the regional center or to services at the regional center, and better yet, to generic services that they need, so that in the kind of hierarchy of needs, they can focus on their child's disability needs or special education needs or other disability related needs, and not have to worry about food or housing and some of those other things. So this community navigator program is helping to make that more possible for families, and you can connect with us. What's the next slide we were going to use?
We're going to move to 30.
Okay, if you show it, I'll know what to say. Oh, this was
Go ahead.
just so that you see that one of the things that they thought was very important is that lived experience. So the state of California, in all of its social service programs, whether it be child welfare, health services, feel that uh, we need to double down on that lived expertise that people have to help others who are on their journey to address the challenges that they have. Were you going to do this one?
We're going to breeze through this. So this will be in your the PowerPoint that you received, but we really wanted to highlight the FRCNCA's Community Navigator program because it goes beyond just basic navigation. Our navigators work closely with individuals and families to help them better understand and access both regional center services and the community resources. And a big part of that work is really building trust. That's with the families and with the regional centers. And navigators often come from the communities that they serve, and they bring that lived experience that we've been talking about that really helps families feel more confident and asking questions and learning how this system works because it's confusing. And another key focus really is making sure that the services are reflective of the cultures and the languages of the communities being served. So our lead FRCs, there are 21 community navigator leads that have tailored their approach to meet the needs of the communities within their regional center catchment areas and ensuring that services are responsive to the language, culture, and experiences of the families that they support. And I think we're going to show the impact of this work with some of the data we've collected. So I'll switch over.
Yeah, and I just wanted to show that, what we collect data about the work that we do with families. So on the next slide, you'll see that in the 3 years since we started this program, individual families have come to us with over 6,000 barriers, and we have reduced their barriers to from 6,000 to 850 barriers still existing for families over those 3 years. So community navigators, or it's also in health services called community health workers. Those services really help. Next slide, please. And then I think I just wanted to point out on partnerships. Part of what we have been doing is doing the work through partnerships, and we really encourage you, again, to become a partner with your local Family Resource Center or with the Community Navigator program that's local to you. And so I'm going to go ahead and skip to you'll have in your slides, you'll see some of the collaborations that we do here. And we want to go to Chanel and share with you her experience in the program.
Okay. And so far, working with us at the Eastern Los Angeles Family Resource Center, how has your experience been? Have we have we contributed to your early start experience? Any positive feedback? Anything we can improve on?
I mean, I will say that you guys were a godsend. I'm a first-time mom, and even though I work in education and I raised two of my stepchildren, this was uncharted territory for me. And so, um, I also didn't have a very positive experience with anyone leading up to the Family Resource Center. And when I say with anyone, even talking to the pediatrician saying like, hey, something's not right with my child, and her like, oh, that happens, like it's fine. Like every step of the way, it's been a battle. Early start program, testing, like everything was a battle. And so this was really the first stop that I had where it was really like a breath of fresh air and came with support and came with answers. And anyone really listened to what I was saying. And it was you that I actually first spoke with, and you were like, well, you know your child. And it felt really validating to hear that, because up until then, and I had started this process at 18 months, and my son was 2 at the time. And so up until then, no one validated the fact that I know this child, I had this child, I spend 24 hours a day with this child. And so it was really, really refreshing.
All right. Do you want me to
Okay.
set up Dulce?
Yes, please.
All right. So you got to hear the experience of one of our family members who interacted with a community navigator. But we wanted to also hear from one of our community navigators at Eastern Los Angeles FRC. So I'm going to hand it over to Dulce, who's our next speaker, who will talk a little bit about the role of the community navigator and share how she supports families at the Eastern Los Angeles Family Resource Center. Dulce.
Thank you, Robert.
Okay.
So my goal here is to highlight how impactful we as community navigator in supporting families. If you could go to the other slide, Robert, thank you. So through our guidance in advocacy, connections to resource, we help families feel supportive, empowered, and not feeling alone through that process that sometimes it could feel challenged at that moment. We might not have the answers, but sometimes parents just need somebody to listen during that challenging times. And families just need that support and that reassurance that there's somebody there just to listens to them. And that's all they need. And that's how we build trust with families. Next slide. So how do we do that? So we do a initial intake process. We listen, we kind of find what is the conflict or what is the concern the family might have. And we do this with a program that we got trained on, which is Mind the Gap. We go through, like I said, the intake process, and then we do a goal setting. Once we find the problem, then we set up a goal that the family wants to accomplish. And then after setting that goal, we do the coaching sessions to help families overcome the barriers. And then from there, we do like a check-in with the families after to see what worked, didn't work, and if we have to make any changes through the goal settings. So with that said, I'm gonna share a so you guys can have an idea how do we work with families. So I have a testimonial from a family that I was working with during one of our situations. This family or this parent, she was a DCFS mother that felt that a barrier for her was communication with her social worker. She felt that her communication style or her culture was a barrier for her because uh, she felt that her way of communicating was aggressive, and she felt that the social worker was not being flexible with her. She all she was asking was more hours for her to be with her daughter. She wanted to build that connection with her daughter. She felt the meeting in this little four-wall room was not an ideal room for her to make that connection with her daughter, and she was asking for her to have an outside space, maybe in the park, uh, where or maybe taking her daughter to have like a a special moment, taking her out to eat. But the social worker was not in compliance. She felt that that was not appropriate. So there was always that barrier, right? So the mother was really already closed off. She felt the social worker, because she was an African American, that was the number one barrier for the mom. So the parent came to me or came to us uh, already disappointed. She didn't know what to do. So after I heard what was the mom needed our assistance, then we set up a goal, building that communication, right? So we had to build a different way for her to communicate with the social worker. And then after that, we had to build a plan for her to follow through when she was going to talk to the social worker, and her approach when she was going to talk to the social worker. And then also providing her ideas of how was she going to provide of different places for her to interact with her daughter. So if the social worker wouldn't give her the opportunity, then what was the next approach she would come with the social worker? So then when we did that, the mom was not being upset. It was more of like, okay, let's regroup and introduce that. So the next slide, Robert. So by listening to the parent and providing the guidance, mom felt validated and she felt helpful and she felt understood. Mom didn't felt that the information that she was provided, it wasn't me turning away. And she felt that I was able to calm her down because she felt validated. So at that time, we built trust, and she felt that she was able to feel hope that there was a plan in action. So for me, giving her that ideas that with things that we could build on was something that she could take with her and then start working together to get to the end point. Next slide. So with building clarity, mother wasn't afraid to ask questions to the social worker. She was able to explain a little bit more of the process and then what she wanted from the social worker in the next meeting with her. Instead of feeling when she would go to the next meeting with her social worker, feeling hopeless and being angry, she was more clarity of feeling more calm, and then she was able to communicate her needs in a different way where she felt more confident. Even though the social worker turned the her request down, she felt that maybe the next time if she came back with a different approach, it would have been helpful. And then she kept trying. She finally came into the social worker came, oh, maybe if you try this next time, it might be helpful if you do this. So there was that back and forth from the social worker. So she saw a little change happening. Where in the beginning, there was just that wall between her and the social worker. Next slide. So using step by step, like giving parent the clarity, giving her feedback. Sorry.
Sorry about that.
That helped reducing the stress significantly because from the parent providing me information back every time she had that meeting with the social worker, that gave me opportunity to build up more information for me to give her back and give her more of that step direction for her to take back. So eventually, she was able to create something that was able to get her to the end of results that she needed to get her hours extended, and then also get time to spend outside these four walls that she wanted with her daughter. So she made a big progress with her social worker, that connection with her daughter, and then she broke down the barrier with the social worker that she felt that was something really important she wanted to do. Next slide. Next slide. Sorry. So by understanding the mother and making that cultural connection was really important to help the parent. And she felt respected and she felt understood. So that's something really important also as a community navigator, that we have to also connect with families in that way to help them. Next slide. So for us, it's really important that parents feel supportive for them to feel trusted and feel that empathy that we have with our families, to guide us and be able to help them. Next slide. And I just want to share what the parents said after. I felt supported and you didn't judge me. You just explained things in a way I understood better than my lawyer, and I finally felt like somebody was on my side.
Thank you so much, Dulce. And we're running out of time, so I'm just going to encourage you to make that connection, recognize the need for the family for specialized support, and refer. And there are ways to do that. I'm also going to tell you that after you're done, or I'm just going to encourage you to reflect on how you're going to change your practice today from what you've learned in this training. You know now that there are family centers that are disability focused, and you know through this, at least through the PowerPoint, how to get connected. You have our website and I'll put the link in the chat here, and I'll send it to Robert to wrap it up.
Yeah. So I know we're running out of time. I was going to do a little hand over hand, show you the website, but you can always go to FRCNCA.org. We have a Get Connected section, and it's a perfect place for you to get connected now. Just a reminder, 47 FRCs. They serve all 58 counties. So I saw someone was asking about, hey, is there an FRC in Kern? There sure was, right? So Yvette sent you that information. And on our website, you'll be able to get all of the information you need. So that includes the name of the FRC, the counties that they serve, their address, the phone numbers for referrals, and a link to their current website so that you can either make a referral yourself or you can send that information to families or individuals who may need more assistance. And so
I put the link in the chat.
Oh, thank you so much. I appreciate it. And that brings us to questions. And I think, Yvette, you've been kind of going through the questions in chat.
Yes, I have.
Yeah, if there's anything else that you have, I think we might have time to look at the chat if there's something. Otherwise, you can always, I will just put that next slide up. Contact us at info@frcnca.org. So, if you need help connecting to an FRC, you have a question about partnership, we always highly recommend to reach out directly to the FRC. But if you need assistance, we're here to help and happy to do that and set up that connection with you. So yeah, Yvette, any last words?
No, I thank you all for listening and for what you do for families and individuals every day, as I like to say, on a Tuesday or a Thursday. You're out there making a difference, and it is really appreciated, especially when families, get connected to the resource that they need. So thank you.
Exactly. And so that I also thank you. And Jessica, I know we have one more slide.
Oh, here I am. So this last slide of ours, we just want to, of course, on behalf of CalTrin, on behalf of the participants, say thank you to the three of you so much for the expertise that you brought, for all of these strategies and considerations. I know you'll see a lot of thank yous in the chat there. And for those of you that are looking for a certificate of attendance for today, there is a survey that has been dropped into the chat. That survey you can access and it'll be active after we close out this session. And as usual, it's the CalTrin way. In about 2 days, you'll receive an email that will have some of the resources that were discussed, as well as that survey link if you miss it. But with that, we want to say thank you all so much again for being with us. Thank you, presenters, and we hope to see you again. Have a great day, everyone.
Everybody, take care.
Bye.